Hello all. So, I'm Dr. Walter from SNS College of Physiotherapy, and today we are going to see another video regarding the neurogenic bladder. Okay, so neurogenic bladder, it is not a separate kind of condition. Okay, so this condition will be associated with other major things. Okay, so other major things means maybe it may be a stroke or a spinal cord injury or any type of abnormalities. Okay, so in this video we are going to see all the factors and what is the types of neurogenic bladder, what is the usage of a normal urinary bladder. All these things will be seen in this video. Yes. Now, what is the function of the normal bladder? Now, you can see this one. In normal bladder, the main role of the normal bladder is the detrusor muscle. Okay, so in a human body, there are n number of muscles which are present, and this specific muscle, it is protecting and it's doing its proper function of the urinary bladder. So what will happen in this neurogenic bladder if any defect, okay, of any type of nerve impulses cut? So this will lead to the neurogenic bladder. So what is the nerve which is acting here? So here you can see the spinal cord segments, that is S2 to S4. Okay, the sacral segments which is supplying the nerve supply to the detrusor muscle. Okay, so you can learn in very simple manner in this three conditions. Okay, so first one is the coordinated section of the detrusor muscle and the urethral sphincters, the contraction, the filling phase and the relaxation phase. Now, and this is the pathway, okay, from pons to the sacral S2 to S4. So pons area which is present in the CNS, and from there this sacral pathway, it is controlling the neurogenic bladder. Now we are entering into the etiology. What are the conditions which will affect the urinary bladder? One is spinal cord injury at the level of any level. Okay, commonly we can go for the lumbar or thoracic level. Okay, so in this area, if the spinal cord is going for any type of fracture, the nerves will be going for the intact, that is displacement. It will lead to the neurogenic bladder. Multiple sclerosis, already we have learned what is multiple sclerosis, the myelin sheath scleration of multiple areas of the brain and the spinal cord. Next one is the common point, that is stroke. Okay, for each and every stroke condition, this neurogenic bladder will be present based on the effect. Okay, next one is the Parkinson's disease due to the age related deformity. Now, pathophysiology. As we are learning the clinical neurology for the past these months, pathophysiology plays a major role in determining what is happening, what is making out this problem. For each and every conditions, the pathophysiology will be changing. So what is the pathophysiology for this one? One is detrusor overactivity. The muscle will be active for overactive. For example, if we are seeing someone, they are doing their things with an overactive, over hyping manner, we'll say, so these guys are saying doing the works in overactive. Same way, this particular muscle will be functioning in a overactive, that is controlling, that is voiding. All these things will be in a higher content. Next one, dyssynergia. Dyssynergia means, so it will contract simultaneously, that is will be leading to the widening of the urine continuous. Okay, and next one is the detrusor underactivity or acontractility. So here the contraction will be less or the absence of contraction and loss of sensation. Voiding of urine in some cases will be completely loss of sensation. They cannot able to analyze whether they are voiding the urine or not. Okay, now types of neurological bladder. So types of neurological bladder is divided into two types. One is spastic, that is also known as hyperreflexive, and another one is flaccid, that is atonic or hyporeflex. And this flow chart, you can see what are the combination. Let me see in this flow chart in the major things. Features: lesion type, detrusor activity, bladder capacity, that is a holding capacity, and emptying, and the key symptoms. So based on this common things, it is divided into two types: spastic, upper motor neuron lesion; flaccid, lower motor neuron lesion, and detrusor activity is going for overactivity, and this flasher will be going for underactivity. So these types of things is majorly working out in all this area. Now going for the next one is the clinical manifestation, signs and symptoms, diagnosis. Okay, so these are the diagnostic techniques which can be used. Okay, urine analysis culture, pathological culture we have learnt in the pathology subject, and the imaging, MRI imaging, CT scan, abdominal CT scan. These are the famous techniques for the imaging. Urodynamic studies, that will be a gold standard technique for determining whether it is spastic or a flaccid thing. Okay. Now, complication. What will happen if a patient is going for a complicated neurological bladder? UTI infection is most common in the neurological bladder conditions. Renal dysfunction leading to the renal failure, commonly known as kidney failure. Okay. Now, hydronephrosis. Hydronephrosis is most common, that is the swelling of the kidneys. The swelling of the kidneys is most prominent. Lower abdominal plane will be very much higher. Okay. Bladder stones and the autonomic dysreflexia. They cannot able to hold control, and there the voiding of urine will be most common. Medical management. Okay, medical management, pharmaceutical drugs like anticholinergics, these drugs will be useful for the control of the neurogenic bladder. Surgical interventions, it will be going for spinal rectomy, will be controlling with the tube attachment. It is the most last stage and advanced technique used in the medical management. Catheterization. Okay, intermittent catheterization. Intermittent catheterization, it is followed in the each and every hospitalization if a patient is going for a inpatient. Okay, so they cannot able to go on for the restrooms frequently, so this catheterization is most common. As a physiotherapist, we need to understand the techniques which we need to implement on the neurogenic bladder patient. The most common technique is the pelvic floor strengthening exercises. Pelvic floor strengthening exercises associated with the pelvic bridging and the tightening of the pelvic muscles. All these things will be working effectively in this condition. Okay, functional mobility, adaptive equipment. As we are processing a design for the patients who are suffering with the neurogenic bladder, they cannot able to control the urine. So this process will be updated in upcoming weeks in a new model. Okay, the bladder retraining, manual therapy, which holds the gold standard technique in the physiotherapy department. Okay, now conclusion and the prognosis. With this we are concluding, and the prognosis for the physiotherapy treatment is much higher, as we have learned, as we have done many researches regarding the prognosis and the case study reviews. So guys, so it is most important as a physiotherapy student, we need to understand these techniques to implement in our clinical practice. Thank you all.